Hi, my name is Dr. Blake Ridgway and I'm with Neighborhood Dental. Today I'll be walking you through the steps of the implant process and what you might expect as a patient. In Neighborhood Dental, we often recommend implant therapy for patients to replace missing teeth because it's the most lifelike or most natural way that we can replace a tooth. But ultimately, we believe that implants can be most comfortable, most permanent, and most aesthetically pleasing for our patients. The first thing we would do is complete a comprehensive exam with our staff and the doctors. At that visit, we're reviewing your medical history, your wants, your needs, and your expectations for tooth replacement. There may be other options we discuss, and if implant replacement is the best option for you, we'll talk about the availability at the site, the planning, and go over the entire process in depth with you in the chair. When placing an implant, we need to have a site to place it in. Sometimes there's already a tooth in that site that has failed and needs to be removed. If the tooth comes out before the implant, we often place a bone graft in that site and allow up to 4 months for healing so that bone be ready to place an implant. Sometimes that space is already empty and we're putting a new implant in that spot. In that case, we can proceed right to 3D imaging and determine the available bone in the site. After the actual implant is placed, we place something called a healing cap on top of the implant. That helps mold your gums and keeps the implant safe from the oral environment. We may have put sutures in when we placed the implant. If so, we would take those out 1 week later and check the implant healing site and remove the sutures. Placing the actual implant is a lot easier than you may expect. For the patient, it's often less traumatic than taking the tooth out and doing the bone graft or any other dental work. The healing process is also quite quick. We are not altering your gums very often, and you can heal very, very quickly. Once the implant is healed for a period of time determined by your doctor, we then determine if it is ready to restore. That process is extremely simple as well, as most of our doctors are scanning with digital impressions. We are removing the healing cap and placing a scannable post on the implant. A 3D digital scan of your bite, upper and lower, and color of the tooth are picked. We then replace the healing cap and send you on your way and wait for the crown to be made. When your crown is ready, we are taking off the healing cap again and inserting the crown. There are many ways that we manufacture the crown, but at the end of the day, you have a tooth replaced that you're able to floss and function and smile on happily. The steps I introduced today were a broad overview of the dental implant treatment process. Obviously, each of those steps has its own nuances and variables which you and your doctor can determine together. If you're interested in seeing if dental implants are right for you, come see us at Neighborhood Dental.